today. This is Tex, and this is Tex Talks. It's fixing to be Tex get some coffee. I'm plunging, but I'm doing the video at the same time. Yeah, I won't lie. Sometimes get a little bit picky about coffee, and I like good coffee. So if you're ever around Maryland way, anywhere between Annapolis and going all the way out towards Rehoboth, there's a place called Rise Up Coffee, and they are the bomb, let me tell you. So anyway, let me pour this coffee because I bought some ground coffee for a French press. And yes, I still have one or two cups. Maybe one day I'll get it down to less. It's good. Be cool for a second while we talk. So today's talk is about the difference or understanding diagnosis when you're talking about bipolar versus borderline personality disorder. I've kind of mentioned it before in several different places about personality disorders. I have one in specific about why you should be concerned about getting the right diagnosis, and always go back to that. The correct diagnosis helps you get the correct treatment plan, and then approaching the problem correctly and getting the best results for you. And that's what we're looking at, is getting you to that place. So if you diagnose wrong, then you're not treating what you're actually treating. Now, this is going to be a two-part video because one part of it is about distinguishing between the two. I'll go over that again. And the second part will be why, and I'll try to hold out the why part, why it's either misdiagnosed, why it's intentionally misdiagnosed, why people don't like certain diagnoses and want certain diagnoses. So hang on for that second part. First part, though, understanding, and I'll go through it again. This is my basic description of mood and depression. And I tell people, if you look at that line, and this is your average like graph of you throughout time, if your average mood is right here. Now, everybody's different. Some people's mood might average be down here. Some people might average might be here. But if you take your average, and then what happens is you look at that straight line, going from left to right, just like on a graph. At the beginning, you're trucking along. This is your average day. Some days good, some bad. A little bit of variance, not a lot. But then something really horrible to you, or awful, or frustrating, or something happens that puts you in a depressed mood. In other words, it pushes your feelings into that sad, depressed state with the depressed symptoms and the issues with sleep or self-care, whatever, the feelings of depression or hopelessness pushes you into that. And it could be something as simple as, changing jobs and losing a job. That's your identity. It could be something more serious, like, grades in school that you're not doing well and you feel really horrible about. It could be even more serious, like death or loss. Someone could pass away. A good friend could move away that you've been close with your whole life. You could be going through a separation or a divorce, or all kinds of things in life that send you into that, that happen, and you start tilting and going into your depressed state, and you dip down. And depending on how far you dip down, they measure that. They have the PHQ-9, which is the Patient Health Questionnaire. When you look at that PHQ, it has these questions, and you go through and you answer them according to the last 2 weeks. That gives you a symptom level, and you put that together with what you talk about for symptoms and the extent of your symptoms, and it might go from just mild to moderate to severe. Now, as it goes down, usually over time, everything comes up. If it's grief or loss, it might be 2 days, 2 weeks, 2 months, 2 years, but eventually people will come back up to that average okie dokie place where they're the same way, trucking along the same line. Now, some people, not by an event, but just because of their own, if you will, brain chemistry, your hormones, other biological reasons, you will get a depression where everything's okay and nothing out of the ordinary is going on, but suddenly you drop. And as I've said before, the best description I've had of that is like being at the edge of the ocean, waving at your friends up on the beach. You're standing in the water, having a good time, and this big wave comes behind you, engulfs you, and drags you down. And when you start going down into that depression, you might see the signs of yourself having it happen, not because of external events, but because you know the signs that you're suddenly not sleeping so well, you're suddenly tired, unmotivated, all those, you know it's happening. And for those people, medication can be especially effective for helping bring that back up to baseline. Okay? And if this happens to you over and over again through time, that's where you get that designator from single episode to recurrent. Cool. Have a little sip of coffee here. That's good stuff. So now, sometimes people will go down and stay down, or they've always been really down, and they keep a low level depressive state. In other words, they never really come back up to base. They never really feel happy for more than a week or two. And if that's going on for like longer than 6 months, 6 months seems to be one of those designated time frames for a lot of things, then that kind of depression is a persistent depressive disorder, the newer term for it, the old one, dysthymia, where you just down and stay down. And I call that, and I got the term from somebody, as where if you understand what a functioning alcoholic is, which is someone who has a drinking problem, but yet they manage to go to work, get up, do their thing, do their responsibilities, but they're just never really able to totally get away from, the drinking problems. A functioning depressive is someone who is depressed all the time, but functions. They manage to get up and pull themselves to work. They manage to get up and do what they need to do and, put the food on the table and throw the dishes in the dishwasher, but they're just never up, but they function. And it's a very sad place to be for somebody. When someone has that, it's horrible in the sense that everything is just a drag and it seems like, everything stays down. I have the expression poop colored glasses because unlike, rose colored glasses where everything's coming up looking rosy there, it's got that beautiful color. When you got the poop colored glasses, everything looks like shit and stays that way. And that's what you see. That's what you hear. That's what you acknowledge. And it's a rough place to be for people. And I really feel for those people who are dealing with that. Now, the thing that will happen for some people is they will come back to that line or they'll be going along on that line, but instead of having the dip down, they have a swing up. And you go, well, what could be so wrong with that? Well, there are some problems that come with that upswing. As a person starts to go into that upswing, if it's just a little bit, they may call that hypomanic, which is hypo under manic, and that lower level mania phase that someone goes into, and they may never go above that level as they're coming up. They may start to suddenly sleep a little less each night, and then they start, speeding everything up. They do more things. Some people can be more productive at work. Some people can get a lot more done around the house. They're on an upswing. They like that place. They're doing things, and especially after you've been down in the dumps for a while, that upswing can feel okay, even good, and some people even crave it. And as you start to pick up, though, you start to pick up too much speed too fast, and then you will start to get very hyperverbal. You'll talk really fast, maybe you'll talk a lot, maybe you might not sleep at all. You start to hyper things like not just the hyperverbal, hyperspending. Suddenly, the credit card is going to get maxed out. Things can happen to you as you do that upswing. You start to maybe become hypersexual and you start engaging in sexual activities that you normally might not do. You start hyper drinking, partying, out every night. As you're cranking up, you start doing a lot of dangerous things. Some people, instead of being in a good mood, get irritable or they get mixed states, mixed moods where they're irritable, but they have energy and they don't know what to do with it, and then they get frustrated, and all those things are happening. And then if it gets up to a real high level, you may go days without sleeping, and you are running like an engine, and you're doing very dangerous things, caught in very dangerous situations. And at the very tip top, you can get to a point where you might start experiencing psychotic symptoms. And that's why, when you look at a bipolar diagnosis, because that may be what you're looking at, someone might have with psychosis, which means that they see or hear things at the top. I do believe I explained in my earlier explanation, I've had clients that you can time it. See, that's the thing. And if you knew when that was coming, you knew when to get them in the doctor and get their medication increased and keep an eye and get family to watch them to make it through that time. Because the thing is that upswing, the depressive cycles may not be able to be measured as much, but those upswings can pretty well be measured. And I've had clients that cycled on the year. Same time every year, 1 year apart, some every 6 months. I had one client, it was about every 6.5, 7 years, they would go through that manic phase. And if you didn't catch them, they would wake up someplace on the other end in like in Vegas or whatever, broke and unable to get back home and spend all the money and have no freaking idea how they got there. That's scary stuff. Um, So when you have that combined downs and then the ups, if it's in just the hypomanic phase versus the manic phase, they diagnose, bipolar 1 versus bipolar 2. And that's that distinguishing thing is when when you go into the manic phase. And at either end though, like I said, you might experience really bad symptoms of like if you're super depressed or if you're in your manic phase, you might have hallucinations or paranoid ideation to a point where you're paranoid all the time and you really think bad things are going, like you've went past just the normal thoughts about it. You've actually started to, like, you're convinced the FBI is out to get you, and Kennedy's assassin is chasing you down, or the government wants you, or the mob, or what. That there's just the number of things is unbelievable that can happen at that top end for some people. Now the thing is, I have heard over the years so many people say, I've been diagnosed with bipolar. Well, here's the thing. Now, with that whole explanation I gave you about depression and the upper phase, that upswing and those symptoms are pretty much locked in time unless you disturb the cycle. Certain drugs, certain medications can slingshot you into a hypomanic phase. Um, That's why when you go in and you're being treated for depression, if the doctor gives you an antidepressant and you swing into those, then they realize you're one of those individuals that it sends you into the mode of, the hypomania, and that you probably have bipolar, and they take you off of the depression med and they try to put you on a mood stabilizer to keep you in between those swings. Now, I have people that will tell me, oh, yes, I have bipolar. And when I ask them about their hypomanic or manic symptoms, here's where the big part comes in. They tell me, oh, yeah, this guy, this girl, this thing, this event pissed me off and sent me into this, and sent me into my manic phase. No, people with bipolar do not have an incident that upsets them and they go into that phase. They don't get irritated at the guy at the cash register, or some friend who says something mean, or somebody who posts something against them. Even having something more serious happen, like breaking up in a relationship. Uh, and especially the way that this is described, that they will go into these phases where they get mad and angry and scream and yell and go into a rage fit and all that, and then the next day they're okay. Sometimes that night, you know, or once they've went into that level of screaming and hollering and yelling and anger or whatever and released all their steam, then they feel better. That's not bipolar. And depending on the other symptoms you have, there's a good chance this is borderline personality disorder. And you go, well, why would a med provider diagnose me with bipolar if I have the symptoms of borderline personality disorder? Some people are not well versed in personality disorders and they don't work with them. So they take a guess at the closest thing they know, and the symptoms look like bipolar symptoms. It's just that bipolar symptoms don't do that. Okay? There's the catch. When you come in and you have depression, and then you have episodes of anger and rage that are inappropriate to the event that it happened from. You go into a rage over things, and you have lots of other symptoms, the ones that we look for, the self-harming behaviors, the dangerous behaviors, the history of tough interpersonal relationships and swings and mood, like the black and white, the splitting, all these things that we look for. When those are present, you're looking more like BPD. And especially if you have a history of it and we can trace it back in time. It's there. The thing is a lot of times it gets misdiagnosed as bipolar. Or you get diagnosed with depression and anxiety and ADHD, and they stack all these diagnoses, and it's like technically one diagnosis really does cover them all if that's what it is. They may want to give you the other diagnosis in order to explain the medication they're giving you, because not everybody has the same symptoms when they have borderline personality disorder. But again, a lot of people, like say you get that diagnosis and then they're treating you for bipolar. And the thing is, a lot of the medications are made to treat the mood swings or the depression. And well, you have those in both bipolar and borderline. So what you really got to do is go outside and look for the other symptoms. There is a difference, and if your mood swings are revolving around events and not around time periods, because remember what I said about the depression sweeping up some people, it has nothing to do with the event, they get depressed. Well, your manic phases or hypomanic phases have nothing to do with events in the world. You could be sitting there and everything's going perfectly fine. You have an average day, day in, day out, and you start to go into your phase. And that's usually spread out over a long period of time. Like I said, it could be months, it could be years. I have people try to tell me that they go into their manic phase once a week. And there is a thing called cyclothymia, and there are what they call rapid cyclers. Those are the golden tickets. There's not a ton of them out there. People who do have rapidly cycling moods may have another mood disorder, but bipolar don't flip daily. So my next video will go into more of why that may be occurring, why some people prefer certain diagnoses, why some doctors, med providers, psychiatrists, healthcare professionals will tend to give a certain diagnosis. Okay? All right. So you take care, and I'll see you next video.